Sickle cell disease is a serious, inherited blood disorder affecting millions of people worldwide. It predominantly affects individuals of African, South American, and Mediterranean descent, but it can be found in other populations as well. This genetic condition has a significant impact on the lives of those who have it. Sickle cell disease is marked by abnormal hemoglobin, causing red blood cells to become rigid and sickle-shaped. These cells differ significantly from the normal, flexible, disc-shaped red blood cells that easily move through blood vessels. These misshapen cells obstruct blood flow, leading to painful episodes called vaso-occlusive crises and organ damage. The blockages can occur in various parts of the body, causing intense pain and potential complications in organs such as the spleen, liver, and kidneys. The sickling of red blood cells is triggered by factors like dehydration, infection, and stress. These triggers can exacerbate the condition, making it crucial for patients to manage their health carefully and avoid known triggers whenever possible. Sickle cell disease is caused by a mutation in the HBB gene, which is responsible for producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. This mutation leads to the production of an abnormal form of hemoglobin known as hemoglobin S. Hemoglobin S causes red blood cells to become rigid and shaped like a sickle or crescent, which can block blood flow and lead to painful episodes and other serious complications. The inheritance pattern of sickle cell disease is autosomal recessive, meaning that an individual must inherit 2 copies of the mutated gene, one from each parent, for the disease to manifest. If only 1 copy is inherited, the individual will have sickle cell trait and typically will not show symptoms. Individuals with sickle cell trait usually do not experience symptoms but can pass the gene to their children. This makes genetic counseling and testing crucial for families with a history of the disease. Genetic testing can identify carriers of the sickle cell trait and assess the risk of having a child with sickle cell disease. This testing is especially important for couples planning to have children, as it helps them understand their genetic risks. The symptoms of sickle cell disease vary widely in severity and frequency. Common symptoms include painful vaso-occlusive crises, fatigue due to anemia, and swelling in the hands and feet. Individuals with sickle cell disease are more susceptible to infections due to spleen damage. Delayed growth, vision problems, and other complications can significantly impact quality of life. Sickle cell disease can lead to serious complications, some of which can be life-threatening. Stroke, acute chest syndrome, and organ damage are significant risks. Leg ulcers and gallstones are also common complications. Diagnosing sickle cell disease involves various blood tests, including newborn screening and hemoglobin electrophoresis. Newborn screening detects sickle cell disease shortly after birth. Hemoglobin electrophoresis identifies hemoglobin S in a blood sample. Genetic testing confirms the diagnosis and identifies carriers. Managing sickle cell disease involves medications, blood transfusions, pain management, preventive care, and sometimes stem cell transplantation. Medications like hydroxyurea reduce the frequency of painful crises. Blood transfusions improve anemia and reduce stroke risk. Pain management includes pain relievers and supportive care. Preventive care involves vaccinations, regular checkups, and avoiding triggers. Ongoing research and advancements in treatment offer hope for a brighter future for individuals with sickle cell disease.